Good afternoon. Evaluation Systems Laboratory, and my research topic is gait cycle detection in patients with lower limb prosthesis, a comparison of manual and multiple force plate modes. First of all, the study of normal and pathological gait in adults have been the leading role in terms of publications numbers in the late 20th century, as walking as an autonomous form of locomotion that allow us to identify many parameters such as asymmetry or balance in musculoskeletal system. And I have worked with video analysis for more than 3 years now, and I begin not only focus on how to conduct research, but how to maybe find any weaknesses in software system or in operators' work. And the topic of my research is directly related to a practical case made by an operator. Next slide. Our motion capture laboratory, motion capture and simulation systems, is equipped with 6 high-frequency infrared cameras, set of reflective markers, electromyography sensors, and 2 dynamometer platforms or force plates. And the main fields of our research is sports, rehabilitation, robotics, and virtual reality. Then next slide, please. And first of all, for right passive markers location, we need to determine them, and we have specialized scheme developed in Italy in St. Olga's Hospital, and it has been tested through extensive quantity of patients. And this scheme is based on anatomical landmarks and joint articulations of our patient's body. And once the passive markers are applied to our patient's body, the cameras register them as undefined artifacts, and we as video analysis specialists not only have to create digital twin model of our patient, but also to reconstruct any lost trajectories. And these blue lines, like butterfly wings, as we can call them, they represent the normal component of the ground traction force. Next slide, please. This diagram shows the gait cycle, which begins with heel strike of one leg and ends up following up heel strike of the same leg. Also, we have a double support period and single support period. A double support period when we have both of our feet are on the ground, and single support period when one of our foot is supporting body and other is in motion. So the next slide. And the analysis focused on calculated the angular measurement differences in gait cycle, to assess operator-induced errors in manual mode comparing to a multiple force plate mode, and to evaluating any visual differences and interpretation these differences. Next slide, please. So what about manual mode, manual cycle detection? The manual mode we use when we analyzing the gait of individuals with extra pathological gait, for example, people with cerebral palsy, or when the length of each step and width of each step is different. And first of all, we as video analysis specialists need to determine manually these heel strikes, toe off, contact with platform, and toe off the platform for each side, right and left of our patient. And this red vertical arrow is support direction force. Next slide, please. So how how does the operator manually define gait cycles, and what does the operator focus on? This image shows marker frames that help us as video analysis operators to determine where heel strike or toe off is exactly the location. Because we have Qualisys cameras and video cameras also, and they are different because Qualisys cameras work at frequency 340 frames per second, and our video cameras frequency is 183 Hz. So, just 1 second. And we are moving to the next marker frame. We can see difference in these pictures, and we can exactly determine where the heel strike of our patient is. But, however, at the next slide. However, if we relied only on our video cameras, identifying heel contact with surface would become more challenging, because during a row of 3 frames we can't see any difference, and we can determine well where heel strike of our patients is. So the next slide. So to summarize theoretical information, we have manual side detection and multiple force plate detection. When we are working with manual cycle detection, we need to determine manually heel strikes, toe off, contact with platform, and toe off the platform. And when we use multiple force plates cycle detection, the system determines only heel strike of our platform with frequency at 1000 Hertz, and because of it we don't need to determine any additional events like toe offs. We need only heel strikes, 2 heel strikes. Next slide. A 2-sample test with unequal variances was applied to determine the statistical differences between these 2 methods, and a significant level of P less than 0.05 was set to assess whether differences in joint angles measurement were statistically relevant. The next slide, please. And this slide represents 2 out of 3 tables, statistical analysis of gait parameters for prostheses number 1 and number 2. And the analyzed segments are pelvis, hip, knee, and ankle, both sides right and left, and 5 trials were conducted, and P values and T statistics were calculated. In some cases, manually defined cycles resulted in notable differences in joint kinematics, and statistical analysis also highlight these meaningful variations in pelvis tilt, for example, and ankle dorsiflexion. And these differences, which varied from positive and negative depending on the conditions, underscored the variability introduced by different gait event detection methods. Next slide, please. And in terms of visual differences, there are also notable differences we observed, because, for example, in pelvis tilt, in manual and multiple force plate mode, in third prosthesis second trial, we see at 8% of gait cycle 8 at 6 degrees, and at the same percent of gait cycle 7 degrees. So the difference between these 2 methods at this gait cycle is 1 and 6 degrees. And for example, at this 67% of gait cycle we have right side 10 and 2 degrees and 9 and 2 degrees. So the difference is 1 degree. These differences influence the interpretation and analysis of patient kinematics made by an operator, and they may lead to challenges with communication with medical professionals. With medical professionals, as one can say that we are in normal range of gait cycle, and other can say that we are already known. The next slide, please. And in conclusion, I'd like to say that this study demonstrates significant differences in gait parameters, parameter measurements when comparing manual mode and the multiple force plate mode. Also, visual interpretations of goniograms comparing manual mode and multiple force plate mode also see this difference, and it is necessary to carefully interpret the results of video analysis of operator, and I will work on ways how to improve these strategies for analyzing step cycle during my work on my thesis. So that's all.
Great, thank you very much.